Welcome and thank you for joining us in this episode in the Fearless Minds research series, Waiting for Help, Solutions for Circumventing Eating Disorder Waitlists. I'm Terry Webb from Flinders University's Fearless Mind team, and it's my pleasure to welcome you to this episode as we talk about something that around 1 million people are estimated to be experiencing at any given time, and that is eating disorders. Most importantly, we're going to explore some solutions for those on waitlists to seek help. Now, to begin with, I'd like to acknowledge that we're hosting this discussion on the traditional lands of the Kaurna people, and that we pay our respects to their elders, past, present and emerging. We also acknowledge and convey our deep appreciation to the elders of all nations upon which Flinders operates. This event is delivered as part of our Fearless Minds series. Throughout this series, you've met Flinders University's most engaging early to mid-career researchers as they bring you their latest research from a diverse range of fields. Today, we're fortunate to be hearing from Dr Kathina Ali, Research Fellow from Flinders University's Institute for Mental Health and Wellbeing. A registered psychologist, Kathina is also a research associate at SAMRI. Now, Kathina, thanks for joining us today. Now, tell us a bit more about yourself and your research focus in the area of eating disorders.
Thanks, Terry. It's my pleasure to be here today. Ever since I started studying psychology, really, I had a strong interest in eating disorders and a real passion to help those experiencing these severe mental illnesses. So in 2014, I moved to Australia to complete my PhD in clinical psychology at the Australian National University in Canberra. And then in 2019, I moved to Adelaide. And since then have been working, in the broader field of mental health and well-being, so doing research in that area, but also continuing with that focus on eating disorders particularly.
Cool. Now, when we say eating disorder, we automatically think about anorexia, which is characterised by low body weight and food restrictions. But what are some other eating disorders and who is most at risk?
This is a really important point that quite often when we think about eating disorders, we have that stereotypical image that's quite often portrayed in the media of an underweight, quite often female, white, young female. And that's what quite often is associated with an eating disorder. However, eating disorders come in all different shapes and sizes, and they can really affect anyone. And that's important to know. Eating disorders could look like someone would be experiencing binge eating. So binge eating would look like someone is eating an unusually large amount of food in a very short time frame and is quite distressed and feeling quite guilty after that experience. And then they would engage in some compensatory behaviors, such as making themselves sick afterwards or engaging in really excessive exercise. That's an eating disorder we call bulimia nervosa. And then there's another eating disorder where you would see the similar pattern of the binge eating, but without the compensatory behavior. That's what we call binge eating disorder. And there are many other eating disorders that we don't know about. And quite often they are invisible. So you wouldn't be able to look at the person and tell that they have an eating disorder, what we quite often think that we can see and tell by looking at someone. They're very invisible and they affect people in very severe ways. And we definitely know from our research that eating disorders are one of the most debilitating mental illnesses that have a huge impact on the functioning of a person and lead to really high distress in the person.
So what's the ideal recovery or treatment process for someone with an eating disorder? I mean, is it a doctor's visit, is it a mental health plan? What's the best way to go?
There's no one size fits all. And it's quite often really difficult for people with eating disorders to reach out for help. There's a lot of stigma around the eating disorder quite often, and there's really, what we know from our research, a huge denial in terms of the symptoms. So not perceiving that their symptoms are severe enough or that they're ill enough or that they deserve treatment. We always encourage people to reach out, which is a really difficult step for the person to do that. Reaching out to family, friends, and reaching out to a mental health professional. So the first step would be to make an appointment with a GP, get a mental health care plan or get an eating disorder plan that will then allow to see a psychologist or a mental health professional, ideally someone who specializes in the area of eating disorders, to then go on the pathway to getting better and to getting evidence-based treatment for the eating disorder.
What are the issues with the current treatment of eating disorders right here in Australia? I mean, how much of a problem are, we're talking about extended wait lists, how much of a problem are they?
So you said before the ideal pathway, and quite often it doesn't look so ideal for the individual. A huge problem that we are currently facing is that we don't have the services available for the demand that we have in our community. So that means someone could reach out, do that pathway, go and seek help from the GP, and then go and call up to get treatment for an eating disorder, but then they would be facing quite long wait lists. And if you think about all the barriers that people would have experienced before they get onto that step of reaching out, overcoming that stigma, overcoming the denial, and then being faced with sitting on a wait list and waiting for treatment, that's quite detrimental. And it can be really distressing and really difficult for the person.
What about with the last few years have been very interesting here in Australia with COVID. What sort of impact has COVID had on eating disorders?
So we definitely saw here in South Australia, but Australia-wide, was actually a spike in people reaching out for help, which is really good. And we're really glad to see that as a profession, that people are reaching out to get professional help for their problems. However, it just meant that the wait lists got longer and longer, and that people are waiting longer to actually access treatment.
Okay, so how was your research examining possible programs and resources that can help people with eating disorders while they're waiting for access to help?
Given that that rise in people reaching out for help and that large demand on services and those increased wait lists is fairly recent. There's not a lot of research on that. And so we really need to advance this area and understand people's experiences on their wait list, understand how we can support them and how we can actually help them to stay on that wait list. Because what we know from experience is that quite often they drop off. And they're really ambivalent about reaching out for help already. And that's very specific to eating disorders. And then if they're on that wait list, they're really at risk of changing their mind and saying, oh, it's not severe enough. I don't need it. I'll leave it to someone else. It's quite often what we hear clients saying.
Wow.
And so we need to support them to stay there. And so we're thinking about those solutions and what we could offer them.
Now, you're part of the Be Well plan. Can you tell us a little bit about that and how that can be a valuable resource for people waiting to get help?
Yeah, absolutely. Over the past years, together with colleagues at SAMRI's Be Well Co, we have developed the Be Well plan, which is a program to improve mental health and well-being. And we've tested the program amongst more than 200 university students, and it was highly effective in improving mental health and well-being more broadly, resilience, but also symptoms of depression and anxiety. And so we thought, okay, what would happen if we gave access to this program to the people on the wait list for eating disorders? Could we perhaps help them to bridge that critical time between being on the wait list and actually being able to access treatment? Could we maybe even perhaps increase their motivation to stay on the wait list? Maybe perhaps their motivation to treatment, and ultimately prevent people from dropping off the wait list.
Okay, so how can people find out more about the Be Well plan?
We're currently running a study with a local eating disorder service here in Adelaide, where we're inviting individuals who are currently on the wait list for treatment to participate in the study. If people are interested in the Be Well plan more broadly, they can find out everything and more information on the Be Well Co website. Now,
you've been a researcher for a while now. What advice would you give to anybody thinking about pursuing a career in research or a PhD in psychology?
You may have been able to tell that I'm quite passionate about the research that I'm doing and really interested in this topic. And actually that started when my PhD supervisor had a chat with me really early on in my PhD. And she said, Katina, you know what? You need to choose a topic that you're passionate about. And that was the advice I've been given. It was the best thing someone has ever said to me, because by doing so, I was able to enjoy my PhD. I'm able to now, 7 years later, continue on with research in that area because I chose something I'm passionate about. So that would be my advice. Choose something you're passionate about and go for it.
That is perfect advice. And look, thank you very much. What a wonderful discussion we've had today. I'd like to say thank you again to Dr Kathina Ali for sharing her research journey with us today. Now remember, you can watch any of our Fearless Minds episodes on the Flinders YouTube channel, and we hope you can join us for the next one. Thank you once again, and bye for now.